For those of you that have been getting fillers in the past, and remember, fillers are the products that you can inject in the parentheses lines or in the lips or the temples or the cheekbones. And if you want to know about the different types of fillers we use, you can refer to another video on IGTV or YouTube, since we talk a lot about those different fillers. But I want to talk to you about today is that when you're going to get those fillers, I feel like most people feel like, well, it's normal to get a lot of bruising, it hurts like hell, but you know it's worth it in the end. And it may be worth it in the end, and the person you go to, the doctor, the medical spa that you go to now, they may do a great job and it looks good in the end. But if you're hurting a lot during the procedure, or if you're having a ton of bruising that you have to let resolve over the next few days, I want to be the first to tell you, you don't have to be in a lot of pain while you're getting your fillers, wherever you're getting them. You don't have to have a ton of bruising, and I want to explain to you why today. So there's two things that I do that makes this a lot better, a lot more pleasant experience for the patient. It's less painful, less risk of bruising. And the first thing is, how do I make it less painful? So when you go in and get injections, like if you get Botox or something, you know, the needle stick is probably the only part that hurts. And when they inject the Botox, it's like the consistency of water, so it doesn't really hurt going in. So a lot of people will offer you a topical numbing cream. And the topical numbing cream is great for that needle stick. The problem with fillers is that the injection, the actual needle stick, that's not the most painful part. It's the actual filler, which is not the consistency of water, it's a thicker gel, and as it goes into the tissues, it distorts the tissues and it's really painful. So a topical cream that only numbs up the skin isn't going to help you with that pain that's on the inside from the gel going into the tissues. And that's why I use a dental block, just like maybe what you get at a dentist, where you go on the inside of the mouth, you numb up the nerves here and here. That can numb up the whole middle part of your face. And sure, you might feel like your eyes are watering, or your lips are huge, or your nose is watering or running. It might feel like that for an hour. You might even talk a little funny for an hour, just like you got a dental block at the dentist office. But it wears off after an hour. But during that hour, when you're getting your treatment, which may only take a few minutes, while your face is numb, you're not feeling any of that pain of that tissue going in. So as you can see in this video here, I'm doing a dental block on this patient where I'm going into the area around his mental nerve, then that numbs up the whole lower part of his face. And I can do that into the upper part of the face, and that numbs up the face, the whole middle part of the face, for the length of the treatment. So the dental block is really going to be the best thing to reduce the amount of pain you have during filler injections. So that takes care of the pain issue. Now what about the bruising issue? Now in this video you'll see that one of the things we do to minimize the amount of bruising is we use a blunt cannula. So a blunt cannula, as you can see in this image, it's a long needle that's just not sharp, it's blunt at the end. So we have to make a needle stick in the skin first to allow us to inject the filler. And as you can see in this example, this video, we are injecting fillers into the lip. And the beautiful part about this is that by just making one needle stick here and one needle stick here, we can treat the whole lip. Think about your normal experience where you're getting like 10 injections on the upper lip, 10 injections on the lower lip, all through needle sticks. Whereas with a blunt cannula, we can just minimize the number of needle sticks, do the whole filler injection to the lips, and by having fewer sticks, you're having less risk of bruising. This is really nicely demonstrated in this image, where you'll see on the left, the patient, each red dot represents a needle stick, and you can see for the lower lids, the under eye hollows, the cheekbones, if you're getting multiple needle sticks in all those areas to fill in and treat all those areas, and multiple needle sticks in the parentheses lines, you can see that with each needle stick, you're increasing your risk of bruising. Whereas in the image on the right, there's just one needle stick to the right and to the left of the nose, and with a dental block, making the patient more comfortable, and then a blunt cannula to inject all those areas, the under eye hollows, the cheekbones, the parentheses lines. We can treat all of those areas through just two needle sticks on either side of the nose. So you can see with fewer needle sticks, we reduce the chance of bruising each time. So if you are having a lot of pain getting your fillers, if you are having a lot of bruising, just know that it doesn't have to be that way. If your doctor's not using a blunt cannula, if they're not using a dental block, ask them why, and then get out of there as soon as possible, because it doesn't have to be that way. You can find somebody else, not necessarily even me, but you can find somebody else to make this a much better experience with a lot less bruising, because you don't want to walk out of that doctor's office looking like you got punched in the mouth or you got in a fight, because it's a lot harder to explain that to your friends and your family and your spouse of what happened. So be on the lookout for somebody that's not going to leave you like you got beat up at the doctor's office. Thanks for watching.